Now I would like to invite Dr. Karthik. Dr. Karthik is a leading surgeon and a young person from Varanasi. He's going to talk about the OCT interpretation, and he's going to give us the basic insight into the OCTA, how does it work, and what are the artifacts in it.
Thank you, sir, for the introduction, and thank you for inviting me to this IC. I'll just start soon. Okay. So, sir has already talked about the clinical modes of the clinical interpretation. I'll just talk about the basics and what are the artifacts in OCTA. So, first, the basics about what is OCTA does. It's a non-invasive technique for imaging the retina and choroid neovascular, and OCTA technology uses laser and light reflectance of the surface of moving red blood cells and to depict the vessel through the different segmented area of eye accurately. So the area of interest is scanned repeatedly over the time, and then the void and all those flow voids, everything is measured, and the area of significance changes between the scans which have a high flow rate. So area with a slower or no flow will have a similarities among the different scans. Like you can see in the second picture, there is a uh, flow void area here, like I was showing in different cases. So it eliminates the need for intravascular dye for vessel visualization. If you see this diagram, like it looks like there is a foveal thinning with atrophy and loss of outer retinal layer. Just notice the scans over the time. So if you see this image, you can see that there's a beautiful network here, which we could have found out, or you could have just left it. But just this OCTA is just a amazing tool to show these network, which can be even missed so many time on a OCT scans. So the light source can be a spectral domain, a wavelength of 800 nanometer, or a swept source with a wavelength of 1050. A longer wavelength have a deeper tissue penetration, but a slightly slower axial resolution. So what are the techniques for motion detection is speckle variance, amplitude decorrelation, and a phase variance. I'll just talk basics about it. Speckle variance is nothing but it analyzes the amplitude fluctuation between the B scans, and a higher variance indicates the flow than the static tissue. And what is decorrelation? Amplitude decorrelation analyzes amplitude fluctuation, uses correlation for calculation, and it does not get affected by the phase noise. And what is the phase variance? It detects the variation of phase of light when it intercept the moving object, like an ultrasound Doppler, more prone to the noise. Or what are the method to remove this background noise? It is split spectrum amplitude decorrelation angiography, what is SSADA, or a volume averaging. Again, the basics about SSADA is it's a full OCT spectrum is split into several narrower bands, and then each scan becomes less susceptible to the noise. So each scan is analyzed separately by the computer, and then it is averaged. So you get a very clear picture rather than getting a picture which has a overlapping vessels or a overlapping void area. So you can even calculate the area which is there for the void. And volume averaging, there is several three-dimensional data sets are required, and then OCTA volumes are averaged to get a final image. OCTA algorithm, again, the sir was telling about 12 cross 12 image, montage 9 cross 9, 6 cross 6, and 3 cross 3. Segmentation is classically by 4 zones, that is superficial retinal plexus, like you're seeing here, then a deep retinal plexus, and the outer retina you're seeing in the third image. Various devices can be the first one is TopCon, which has a different algorithm, which is OCTA ratio analysis, better sensitivity, and reduced motion artifact. The Heidelberg engineering, which has a spectrally true track beam. If you see the image on the side, you see that there's a single beam system and the true track dual beam system, where the reference scan or the cross section scan are differently measured, and then they are analyzed, and the final image is given. Then there is a Zeiss angioplex, where the tracking software is known as Fast Track. Three-dimensional image is obtained depicting erythrocyte flow as well as microvasculature of the superficial, deep, and the avascular tissue. OptoView AngioView uses SSADA and minimizes motion noise and allows quantitative analysis. What are the artifacts? These were the machines and the basics about OCT. I'll just talk a very few points about OCT artifacts. There can be media opacities. Media opacity leads to a lot of signal attenuation, obscures portion of OCT angiogram, or causes a diffuse reduction of image quality. It reduces the vessel density. Maybe different in the different model of OCT machine, but it needs like once you start using a machine, you need to analyze the image over time, and then you can actually reduce these media opacities, or you can even try to figure out what how to take the scan, or how to shift the machine to get a better scan, avoiding the media opacity. Our projection or artifact, inevitable, most prominent and important artifact. Deeper layer reflect backlight and move past the blood vessels, and it causes the impression of vascular layer on the deeper layer, like similar to the superficial vascular layers. So method to minimize this is like slab subtraction, projection artifact removal algorithm, and three-dimensional projection artifact removal algorithm. I'll not just talk details about all these things, because it's a very big topic in itself, but it's just some methods to know how we can do it. And technological innovation has actually reduced a lot of projection artifact removal, and there is a compensation method which are not perfect, nor they are very uniform across OCTA devices. Segmentation error can be there, like so many times you get an image where you'll not be seeing a very beautiful network as you see sometimes. So what is there? Actually, there is a limitation of segmentation. Machine does a very good job most of the time, but there can be some time limitation of that also. Like example, in the PED cases, careful examination with the segmentation can reveal a beautiful network rather than just a machine giving on its own. Like you see here in this image, if you see this area, the network is not actually seen very nicely, and if you do a manual segmentation with the layer by layer segmentation, you will find that okay, there was a even bigger network which we see on the image here. There can be shadowing artifacts. Shadowing artifact is like the OCT beam is blocked and cannot reach the outer retinal layer. There can be drusen, there can be hemorrhage, there can be vitreous floater, or a significant retinal edema can also cause shadowing artifact. Light is reflected back from this structural aberration and does not penetrate the underlying tissue. Area below this features appear as a flow void area. So see this diagram and see this arrow which I am pointing here. There is a shadowing artifact because of the scar here. See this, there is a significant retinal edema, and you see those scans here on the below section. You are not seeing anything useful here. So this is also one of the shadowing artifact.
Dr. Kartikeys, time.
Yeah, I'm done. So again, the motion artifacts are there, which like I'll just there's nothing much about this to talk about. And then there's the extravascular signals where exudate and transudate macular edema can be there, and there in the exudate, proteinaceous particles are suspended in the fluid. The motion of this particle causes extravascular artifacts, and that's all. Thank you so much.
Thank you, Dr. Kartikeys. Such a beautiful insight into the artifacts that are seen in OCT angio. I just like to add one thing, that OCT angio, the segmentation is most important. So segmentation error is something that cannot be